Today we're going to talk about anxiety, which is very apt given what's happening these days with the pandemic. And actually, I've actually given this talk before, and but I've added in some stuff about specific to the pandemic because now we're actually starting to have some research on it, and you know, we can talk some about specific ways to deal with what's happening in this really, you know, unprecedented time of many things happening, and one of them is that, you know, anxiety and depression have really increased a lot, which is not surprising given what's happening. All right. Okay, so going back to the Zoom information, anybody, I don't think anybody was readmitted, but yeah, we're just going to be using the chat box for questions, and I will do my absolute best to answer them, and I'll pause at various times during the talk so we've got time for that. And then hopefully, if I'm good with time, then we'll have a bit of time at the end as well. All right, so this is part of Psychology Month for the BC Psychological Association. There's a whole bunch of talks going on this month. If you want to know the schedule, it's on the BC Psychological Association website, which you can see right there. And you need to go to the menu. I was just actually looking. You need to go to the menu at the top, and that way, and then you'll be able to click on the link for all the talks this month. And we're early in the month, so there's lots of really good stuff out there. There's at least one talk that I saw that's about specific to COVID, but a lot of them are, you know, more general things about parenting and relationships and all kinds of things. So, you know, everybody should go and have a look. Okay. Now, what is the BC Psychological Association? This is our professional association for psychologists in BC. It's not our regulatory body. So the College of Psychologists of BC is if you see a psychologist and they do something that you're not happy with, then the complaint body is the College of Psychologists. It's not the BC Psychological Association. BC Psychological Association advocates for mental health care for everybody in BC. Mental health care is health care. They also provide a referral service for the public to find registered psychologists. They have annual talks to the public in February in Psychology Month. I think this is the third time that I've done this. Last year, I think it was at the Surrey Public Library, so it was in person because we could do that then. And it's also one of the organizations that's provided extra support to the public during the pandemic. So we had, I don't know if this is still going on, there was a phone line service, kind of like almost operated a bit like a crisis line, you know, sort of doing really short-term intervention to help people who really needed help. And of course, the need for that has increased as a result of the pandemic. All right. Now, one of the reasons that we have this month of talks, and also one of my own reasons for doing this, is there's a lot of stigma around mental health, around mental illnesses. I find it really interesting, actually, that people talk about mental health and they really mean mental illness. They really mean problems like depression and anxiety and addiction and bipolar disorder and schizophrenia. That's what people are talking about when they're talking about mental health. And so we want to make it as acceptable to talk about depression or anxiety or any of those things as it is to talk about, you know, heart disease or I don't know, asthma, or, you know, really anything like that, having chronic headaches, so that really people can feel more comfortable about getting treatment, feel more comfortable about talking about what they're going through and getting support. And so that's one of my reasons. That's also one of the reasons that we have the Psychology Month, and just, you know, education for people. There's a lot of really basic information about how emotions work, about, you know, really simple things that we can do to help ourselves, to help other people. And most people don't know about them because we just, you know, talking about how to handle anxiety, which is the topic for today, we don't get that in high school or in elementary school. Maybe we're starting to, but generally speaking, a lot of people don't. So this is to try and help people just get some good basic information, accurate information. There's a lot of information that isn't very good about, you know, how to cope with things and how to deal with really common, you know, really common difficulties that can be very hard to cope with. All right. So this is the schedule for the talk today. So we're just going to started talking about what mental illness is and what anxiety is, how we define it, and what is the role of stress and anxiety. And leading on from that, I'm going to talk some about COVID-19 and mental health.
Got it here.
You got the sound there?
Okay, so we're going to talk about COVID-19 and mental health, mental illness generally. Then we're going to talk a bit more about worry. It's a really common form of anxiety. It can certainly sort of tip over into an anxiety disorder. We're going to talk about like just basic self-care. There's some really, I find that quite often a couple of times I see a client, especially if they're coming in for anxiety, they sometimes think that the things I'm suggesting are almost too simple, too basic, but really they're not. And so there's some fairly easy things that anybody can do that can make a big difference. Then we're going to talk about anxiety disorders, not all of them, just a couple of them, and what the causes are. We're going to talk more specifically about panic, and the title of the talk is "Don't Panic," which panic can be an anxiety disorder. How to treat it, and then we're going to end up with just a short conclusion and some resources. So my goal today is that people go away with better tools, better ideas, better information, and that they can start to use right away. And also you may find that as I'm talking, you might be finding like, wow, actually, I thought maybe I had major anxiety problems, but really what I'm experiencing is kind of normal non-illness anxiety. Or you might find, wow, I thought I was doing okay, but maybe I need to get some more help or more treatment. So, those are more good things to get out of this talk. Wait a second, my thing isn't advancing. Why isn't it advancing? Okay, there we go. That's me. So I am a registered psychologist. Registered psychologist means that I have gone through a big qualification process. Psychologists almost always have PhDs, doctorates, and we also have lots of exams that we do, and including an oral exam with the College of Psychologists. So we're very highly monitored in terms of our training and how good we are and that kind of thing. I've been in private practice since 2009, so coming up on 12 years now. I work with adults only. I don't work with children and teens. It's just not my area. But most of the things that I see are people who are dealing with anxiety, with depression, with relationship issues. Chronic illness and pain is another thing that I work a lot with, and also workplace problems and return to work. Okay, so I'm just going to check before we get into the main part of the talk. Any questions so far? The next slide actually is going to be what do you want out of this. But before I get into that, any questions coming up? You want me to talk slower or faster? Okay. All right.
Nothing in the chat yet, but I'll let you know if something pops up.
All right, great. So if we were doing this in person, I would be standing there and saying, please talk at me, please ask me for things. This is a really good time for you to put in the chat box anything you'd particularly like me to talk about, anything that, as you're looking at my agenda there, didn't look like I was going to discuss, and if you can think of something right now, that'd be great. If not, if it comes to you later, that's completely fine as well. Oh, and I've got something here about unmute yourself while I pause for questions. We're not going to be unmuting for people to talk just because it gets really confusing and overwhelming. So just please put your questions in the chat box.
And just for folks, I do see one request to speak a little bit slower.
Okay.
And if you're messaging in Zoom, make sure you're messaging the general chat box to everybody so that I can see it and then relay that question to Rachel so she can focus on answering them. Because if a bunch are coming in at once, I want to be sure that they come in. We answer them as they come in. The next thing is, somebody's looking forward to learning what's normal and what's problematic.
We will be covering that, absolutely. Yeah, it's a really good question. I mean, quite a lot of the time, okay, I'm going to try and slow down. Quite a lot of the time, because in general, most people don't know very much about anxiety, given that's what we're talking about today. They don't know if what they're experiencing is normal or not. And that's, every once in a while, someone comes in and we have a discussion for the session. And by the end of it, I say, I think you're okay. This isn't actually a disorder that we're talking about. You're having normal responses to a difficult situation. So, that's also a really helpful thing to know.
Yeah, and one person would particularly like to know, Kelsey, about anxiety-related demands placed on us in the outside world, particularly with the new workplace demands in COVID, which I think you mentioned you were going to get to as well.
Okay, so anxiety-related demands. I'm actually not sure what you mean by that. Kelsey, are you able to tell me a little bit more?
I guess it might be just anxiety related to the workplace given COVID. Anxiety
Okay.
related to increased social demands, such as masks. I'm also going to do some distancing.
Right.
Yeah, those types of things.
Yeah.
Yeah, there we go. Thanks, Kelsey. Monitoring contacts, cleaning.
Yeah. Yeah. Okay. Yeah, and I mean, of course, we're doing it right now, but Zoom, I don't think anybody, unless you were in the tech world, people didn't know what Zoom was almost all the time. And now all of us know about Zoom, and there is stress associated with that. So, yes, I can certainly talk about that. And thank you. That wasn't something that I had specifically planned, but we can talk about that. All right. Okay, so this is, this is kind of a pretty graphic. And actually, the good thing about this is on Zoom, you guys can probably see it better than if it was you were looking at it in a big room. But essentially, what this is talking about, and this is, I think, based on the UK, but also more generally, is that problems with mental health they're very prevalent and they can be very severe. For example, it talks about here about that the stigma of in the UK, employers would be significantly less likely to hire someone who had a mental health condition versus a physical condition, which is one of the reasons actually in Canada we are not, our workplace has no right to know about our health situation. So many times managers don't know that, workplaces don't know that, but they actually have no right to know. The only time they have a limited right to know is if you're on some kind of disability leave that's funded by the workplace. But you can see why. I'm glad we have that protection because there's a lot of stigma. And yeah, mental illness is a really common thing. This is, I think these stats are from 2012. 450 million people have a mental health problem as of 2012 in the world. I'm sure it's higher by this point, and I'm going to get into some stats to talk about how much higher it's gotten due to COVID, or due to many things that are associated with COVID, I should say too. Okay. All right. So these are Canadian statistics. This comes from the Centre for Addiction and Mental Health. I am going to be talking about them a fair bit when I'm talking about the COVID statistics, because they put out a paper fairly recently on it. But the Centre for Addiction and Mental Health is a research and treatment facility in Toronto, very well known, one of the major organizations in Canada that deals with this. So these statistics come from them. And so pre-COVID, all of this is pre-COVID, in any given year, 1 in 5 Canadians experiences a mental illness or addiction problem. So that's 20% of the population. That's high. That means that 20% of the people you know right now are having some kind of mental illness or addiction problem, actually right now, but it will be higher because of COVID. You may or may not know about it. Many people don't talk about it because of the stigma, because of a lot of reasons. And so you know somebody, maybe it's you, maybe it's, but you know. By the time Canadians reach 40 years of age, 1 in 2 have or have had a mental illness. That's half of us by the age of 40. So 20% in any given year, half of us by the age of 40. Mental illness is a leading cause of disability in Canada. I think depression is it's the major reason, or one of the major reasons, that people have to take leave from work. And certainly in my work, in my practice, I see that a lot. And mental health care is underfunded, and many of those with mental illness do not receive optimum treatment. Yes, absolutely. That completely fits with my experience. It's actually relatively rare that psychologists are working in the public health system. The people that are hired tend to be counselors or therapists, which, they often provide very, very good care. But there is an extra piece that psychologists that can do, that is, we do a lot of diagnosis and assessment that counselors cannot do. So yes, there's definitely issues here. And specific to anxiety disorders, that affects 1 in 10 Canadians, according to CAMH, the Centre for Addiction and Mental Health. The Canadian Mental Health Association says 1 in 5. So we're looking at 10% or 20% of all Canadians experience an anxiety disorder, which is anxiety at a level that it is significantly interfering with the person's life. Okay? That's not talking about anxiety that doesn't reach the level of a disorder. Okay. So what is anxiety? I think this is where we come into what's normal and what's not. So anxiety is a normal reaction to stress. Sometimes when a client will come in and say to me, well, I just don't want to have any anxiety, and that's not possible. And also not a good thing, because one of the things that anxiety does, some of the things that anxiety does, is it helps prepare us or alert us that there could be danger, prepare us for difficulties, let us know, hey, there's a problem here. And so it gives us information that allows us to respond to problems, difficulties, stress in a way that hopefully will make those things better if possible. When you get to an anxiety disorder, that's a level of fear and anxiety that's really high. It's out of proportion to the situation. So, if we talk about phobias, most people are not phobia. I kind of don't want to mention a specific phobia in case somebody here will react, because phobias are quite common. So I'll pick a ridiculous one. Nobody has a phobia to lamps, but say you have a phobia to lamps. Most people don't find lamps frightening at all. They don't even pay attention to them. They ignore them. If you have a phobia to lamps, you will be avoiding it. You will be finding them very frightening. It will be something that will affect your ability. For example, you might sit in a room without any light because you're frightened of lamps. Again, nobody has a phobia for lamps. I'm using it as an innocuous example, so I don't trigger anybody. But anyway, that would be an example of fear that's out of proportion to the situation. Or it's inappropriate to the person's age. So one of the childhood anxiety disorders is separation anxiety. So that's when a child is really frightened of being apart from their parents. And at younger ages, and at certain times, that can be completely normal for the age of the child. The child gets above a certain age, I think, sort of 5, 6, 7, I think, then it becomes something that's no longer normal for that age. And the other thing is that in order for it to actually be at a level of disorder, it has to stop your ability to function normally. So, again, if we go back to phobias, many people have phobias for things that they almost never see. So it just doesn't affect their ability to live, to work, to have relationships. So given that, it wouldn't be considered an anxiety disorder. It's when it really affects your life negatively that it becomes a disorder. And anxiety is the most common of the psychological disorders. What causes stress? Okay, bad things happening, and of course, right now we have COVID-19. So that's a really bad thing that's happening. But in general, it can be anything that increases your anxiety levels, and certainly something can be stressful for you, but not stressful for somebody else. There is, some individuality to it. When things feel or are out of your control, that is very stressful, or can be very stressful. Again, it depends on what it is. And one of the things we'll talk about later is how to deal with stressors that are about things that you can't change. conflict between what you believe and what you experience. So, for example, this quite often comes up in relationships where people will have a belief about, say, during an argument, one person might have a belief that it's perfectly okay to yell at your partner. A lot of people grow up in families where there's a lot of yelling and shouting, not necessarily, it certainly doesn't, that's not necessarily abusive, but that's how their family does conflict. And other people grow up in families where nobody ever yells, and sometimes where nobody ever talks about problems. So if you believe that it should be perfectly fine to yell, and you're with a partner who is not okay with that whatsoever, that's a conflict between what you believe and what you experience. And so that can really create stress, especially if you don't know what to do. How do I fix this? How do I change this? A number of stressful things happening in a very short time period. I think all of us have had times where, for whatever reason, there's a bunch of bad stuff that happens. Oftentimes it's unrelated. I've had clients that come in and, they've just separated from their partner and their mother's just been diagnosed with a bad illness, and, they just found out that they're losing their job, and, all of these things, some or all of them are things that they haven't done anything wrong, but they're happening all at the same time. Very stressful. Confusion or that you don't understand, also a stressor. Again, if somebody's angry at you, if you're not doing well, if somebody's telling you that, at work that your performance is not good and you don't understand why, very stressful. Not feeling heard, again, often a relationship thing. You're not understanding what I'm saying to you. I can't figure out a way to get you to understand. And having no time to yourself or to relax. And that was one of those things that COVID's been really odd with. For some people, they have way less time than normal. They have small children, school is not happening, or it's happening online, and their kids are home way more, and they can't get a babysitter because of COVID, or their parents can't come and look after the kids because of COVID. And so they have less time. Some people have more time. They're not commuting. They're not going out doing anything, and so they have way more time. Both of those things can be very stressful, especially if you don't choose them. And none of us, of course, have chosen COVID. Okay, there we go. So as the stress meter goes up, you're more and more likely to have something like a panic attack, which is a 10 out of 10 of anxiety. How am I doing with the talking? Better? I haven't had any comments, so I'm assuming it's okay.
I have one comment saying it's still a little too fast.
All right, I'll try and slow down. My apologies. All right, so here we come to the COVID information. So this information is from CAMH, which I was talking about earlier, Canadian Centre for Addiction and Mental Health in Canada. Canada was already in the midst of a mental health crisis prior to COVID-19. Yes, I can't disagree with that. CAMH is an advocacy organization, though, as well, so they have reasons for saying that, but even prior to COVID, there was a lot of problems. So I'm sure as you're looking at this list, this looks really familiar to you about what people are anxious about in the pandemic. And these are very reality-based stresses. Some anxiety is not reality-based, in that, you're frightened of or anxious about something that most people would be fine with. Some anxiety is very much reality-based, and the COVID anxiety is strongly reality-based. And so 50% of Canadians are reporting worsening mental health. This is from data in July 2020. 44% worried, 41% anxious. 25% of those aged 35 to 54 reported increased alcohol use. That is a problem with anxiety. I mean, it's a problem generally. It's a problem with anxiety more than people think, because most people have the experience of when they have one drink or a couple of drinks, their anxiety level goes down. But overall, when you're drinking too much, your anxiety goes up. So it's one of those kind of paradoxical effects. Cigarettes are the same thing. Most people who smoke say that it's relaxing when they smoke, but there's chemicals in cigarettes that act kind of like caffeine. So, so people who drink and smoke, those are things that put you at increased risk for anxiety, even if there's not a lot of drinking and smoking going on. 81% of working Canadians reported the pandemic negatively affecting mental health. So that, I think, goes back to that question at the beginning about working in the context of COVID. Many people, I mean, the only people I can think of where COVID didn't affect their work life much were people who were already working from home. For pretty much the rest of us, we had a very fast transition, I include psychologists among this, to working almost entirely not from home to working entirely from home or entirely remotely. And that's difficult, especially if you have small children, because especially at the beginning, the small kids were not at school. And they're not old enough to know, hey, mommy or daddy has to be on a work call. You can't interrupt me right now. So a lot of stress there. This is purely anecdotal. I have not looked at the research on this. I don't know if there is any research on it yet. Many people are reporting finding Zoom difficult to focus. That in meetings when it's in person, you can usually be kind of like taking notes or maybe even staring out of the window or, being able to have shifts in attention, which we all kind of need. That's much harder on Zoom because often you're expected to have your camera on, you're expected to be looking at your camera the whole time. And that's not normal, and that's hard. So if you're able to turn off your camera at least some of the time, that's helpful. It's not enough, but it's helpful. I think we're going to talk a little bit more about the social demands, mask, distancing as well. Okay. So the COVID-19 pandemic, according to the World Health Organization, has disrupted or halted critical mental health services in 93% of countries worldwide, in a context where the demand for mental health services is increasing. Canada has done not too badly because of telehealth, and that is so telehealth is video services, telephone services. I mean, I personally actually find it's much easier to get hold of my doctor these days if I can get a phone session. But nevertheless, she's missing information about me. She can't see me. She doesn't know what's going on with me other than what I can tell her. And I know for myself, one of the things that can be really telling is when I can look at my clients, especially if I know somebody well, and the video is okay for this. I can look at them and know that, hey, wow, you don't look good today. And you can't do that on the phone. So it's not perfect. It has replaced services to some extent. And again, the World Health Organization, like CAMH, also says that prior to the pandemic, funding and services for mental health were already not good enough, nowhere near good enough. So if you are finding that you're having difficulty getting services, this is a common experience. And I'm going to be talking more about some resources right at the end. So hopefully that will help. And of course, these talks this month is one way to at least get some more information on that. Some groups are more affected by pandemic-related anxiety and depression than others. Again, this is from CAMH, Center for Addiction and Mental Health. Women. Women work in many of the industries. They are dominating many of the industries that have been most affected by COVID. So women have been more likely to lose their jobs. They're more likely to end up with the bulk of childcare. And, many people lost much or all of their childcare during the pandemic at various times. People who lost their job because of the pandemic, well, yeah, of course. People who have financial concerns, and some people will have financial concerns even if they didn't lose their job. People with small children at home. I am certainly finding that my clients who have been pregnant through the pandemic, who have small children at home, are struggling. They have lost much of their support because of the social distancing requirements, because of, even at this point in time, even with masks, we are told you can't see people outside of your own bubble inside. And it's wintertime. What the heck are we all supposed to do? And I do have some suggestions later on about how to get social support, how to do it with the COVID restrictions, but it's hard. And many people really miss being hugged, being touched. That's why there's been some, lesser restrictions for people who live by themselves. Of course, people who have little children are probably being hugged so much by their kids that they feel like, please don't touch me. And they don't get any space where nobody touches them. Anyway, so another group that's been really badly affected is young people, teens and young adults. I have a teen in my own household. They're not going to school. There's no work. Anybody who lives in a household where there are vulnerable people are, going to be much more tentative about what kind of work they can do, if they can work. Of course, that will also relate back to financial concerns. People, teens and young adults, if you're living independently, that's very difficult. And in fact, many people have moved back home, which creates its own stressors. Essential workers, not a surprise. They have to go out and face the risks. And many of them are also people who are in other vulnerable groups, and COVID-19 survivors. So, I think we can all see why that these people would be at higher risk of anxiety or depression. One of the responsibilities that registered psychologists have is we actually have responsibilities to fight racism, to fight discrimination. We actually had a workshop about that last week. So that's one of the reasons this list is in here, is to point this out, but also because it's true. Anybody who belongs to a group that has some kind of systemic disadvantage, some kind of barrier or barriers to care, to resources, are even more at risk for pandemic-related mental illness. So, for example, going back to youth, for youth that are LGBTQ2S, so, are queer, lesbian, gay, bisexual, trans, two-spirited, intersex, from some of them, many of them, living with their families again is not safe. Sometimes only not psychologically safe, sometimes physically unsafe, because they are not out to their families, or they are, and it's very problematic. So that's another way in which people have been really affected. This data, though, is mostly not Canadian. We don't have much data on this in Canada, mostly from the US and UK. Quickly, this goes back. This is Canadian data. This is from StatsCan. The report's from October 2020. And for people with pre-existing mental illnesses, 73% reported worsening mental health during the pandemic, and definitely have seen this in my practice. Visible minorities also doing worse than, I don't like the term non-visible minority, but, anyway, they're doing worse. However, counseling services and support groups were among the least affected health services during the pandemic. So things like routine medical tests, some surgeries, visiting the doctor, really affected, because telehealth is easier for counseling and support groups. That was less affected. Now, let me see here. Let me just go back a bit just to address those stressors about social demands, masks, distancing. Essentially, really all of those things are stressors, obviously. And so we are going through a time when there's huge stress in the world. Everybody's affected by this, or many people are affected by this. And we all have to change our behaviors in ways that are not nice, not easy. This creates real problems with friendships. I think most, or maybe all of us, have had at least one friend or family member that is really different from us in how they want to deal with the pandemic. Whether you're more relaxed than they are, or you're more, strict than they are, or they think some things are okay that you don't, vice versa. This places enormous strain on relationships. And even more so if you're depending on the other person for something. Whereas whether it's grandparents for childcare, it's somebody that you live with, something that you work with. For people who still need to go into work, essential workers, extremely stressful having a coworker who's doing it really differently than you do. And people are really lonely. Loneliness has really increased during the pandemic. So we're going to talk about some ways to manage that. And, it would be better in the summer. We can meet outside. Okay. Just in terms of long-term effects of the pandemic, we don't know yet, obviously. But there is data from the SARS pandemic. I don't know if people remember that. It was mostly in Ontario. It was the sudden acute respiratory syndrome pandemic. And people who had it, who had the illness, they had symptoms of depression, anxiety, and post-traumatic stress 1 year afterwards at a level of 64%. That's high. It's really high. And at least one diagnosable mental illness 2.5 years after the crisis, especially for healthcare workers who had SARS. But this was a much, much more circumscribed effect. I mean, I was living in British Columbia at that time. I really don't remember anything in British Columbia that I had to do differently at all. I think people in Toronto did have some stuff. So it had minimal societal effects compared to COVID-19. With COVID-19, it could be worse than SARS in terms of how people are, 1 year, 2 years, 5 years after the illness, after the pandemic's over. But we also know that if a stressor is a shared and common experience, ironically, that can help. People feel less alone. They're more likely to feel understood. People get it. We're all going through it in different ways. This isn't on the slide because I couldn't find the reference, but after World War II, there was a belief that many, many people in society would be really anxious, really depressed, would have nervous breakdowns. And so they built psychiatric hospitals in the UK anyway, expecting to have them full. And they weren't. They were used even less than I think at pre-war levels. So, in World War II, that was an enormous, incredibly traumatic worldwide set of experiences. So it's possible that after COVID-19, we could be better than we think we are. I'm hoping for that. All right. I'm going to skip over this. It's just to say CAMH made a number of recommendations for the government to help with COVID-19 effects. And they're talking about not just sort of healthcare ones, but also things like, reducing poverty, increasing housing access, supports for people to stop drinking or to decrease drinking. So those are kind of interesting, but we don't have time for that. Sorry. Okay, so again, if we were in a room in person, I would be saying, you don't have to tell me this, but if anybody, just to think about it, what's your stress level right now? And in 2020, 2021, I've just talked about a whole bunch of extra stress that we will have. But the kind of these are typical sources of stress. Other than that, work, family, health, finances, all of these affected by COVID for many of us, but nevertheless, other stressors going on too. And so just, think about, do you notice the connection between your general stress level and your overall anxiety symptoms? Most people do. But, it can be kind of hidden. Sometimes people come in to see me and they're saying, I don't know why I'm suddenly having panic attacks, or I don't know why I'm so stressed. And then we talk about their lives, and by the end of the session, it's like, oh yeah, there's a lot going on here. No wonder you're really stressed. And it can be, especially if it comes on kind of slowly, the frog in the hot water thing gradually heats up, frog doesn't notice. It can really hide how much stress you're actually going through. Okay. Let the stress begin. All right. So one of the really common symptom of anxiety is worry. And this is a good example of something that's really normal. It's normal to worry, but it can kind of get out of control. It's also something that for some people, it's one of the things that they feel is it's a way that I love people. So if I love someone, I worry about them. And I would encourage you, if that's what you do, to try and pull those things apart and recognize that you can love someone without needing to be worried about them. Even if they're going through problems, you can be helpful, you can be there for them. You don't need to be worrying about it, especially if it's about somebody else, especially if it's about another adult. It's often things that you have no control or influence over. This is something that my family is really good at. I'll talk to, one of my aunts or something like that, and they'll be like, oh, so-and-so, another adult in the family is going through relationship stuff, or their kids are having a hard time, and, I'm just so worried. And they're not doing anything with this worry necessarily. They may or may not be offering help, but they're just sitting there being worried. That's actually not helpful for anybody. So try not to do that. It often feels repetitive and can sometimes feel obsessive, going in circles a lot of the time. And it's nasty. It feels stressful. It feels frustrating. It feels sad. At its worst, it can be something called generalized anxiety disorder, where the worry is really interfering with the person's life. This is normal worry. Going back to that question, what's normal and what's not? Everyone worries sometimes. When you're stressed, you tend to worry more. In the context of COVID, we have more things to worry about. One of the things I think many of us have found, and I'm no exception, is that sometimes I don't know what's enough. Have I cleaned enough? Am I cleaning too much? Did I clean the right things? Did I touch something and not realize? Did I remember to wear a mask? I remember going into a public washroom. I was out on a walk and I went into a washroom. I forgot to put a mask on. And I came out and thought, oh no, I forgot to put a mask on. Because we don't normally do that. How much should I worry about it? I didn't get sick, so that was fine, but I might have. So we're going to be worrying more, and especially when we don't have tons and tons of information. And with COVID, the information keeps changing as they find more things out. So yeah, it tends to increase the times of high stress. If you don't have generalized anxiety disorder, you're less likely to react really strongly, and you're more able to calm yourself down when you do worry. So that's one of the things about generalized anxiety disorder. It's really hard to stop yourself from worrying, to stop the worrying from being really horrible for you. Okay, when you're worrying about something, do you have any control in the situation? We talked a little bit about this a couple minutes ago. But if it's something that you do have control over, okay, I'm worrying about this. This can be a cue or a trigger for me to say, okay, let's look at some ideas. Try and make a plan. Maybe talk to somebody who can be helpful. If you have a work project that's feeling, too much, or you're not really sure where to start, or you need more resources or more information, it's a great idea to go to your manager and say, what do you want me to do here? Where are the priorities? Can you help me with, I think I might need someone else on this. Is that a possibility? All of those kinds of things. And your manager might come back to you and say, this is it, this is what you've got. Okay, then you can start to make a plan, even though, it can be very stressful. And you hope that your manager will also give you more time or maybe simplify things to make it easier for you. But you can actually start to look at some steps, take some actions. If it's not your problem, and a lot of the time people worry about stuff that's not their problem. And in the context of COVID, I find that people worry a lot about what other people are doing. Whether it's the government, whether it's, a business, whether it's somebody in your family or a friend, you can't control that a lot of the time. You might be able to give the person input. It might be very important to you to try and do that, but in the end, you can't make them. And so in those circumstances, I like, it's not my circus or my monkeys. It's not my problem. Because, anything that makes you laugh a little bit is helpful. I need to work on what I can control. I certainly have a couple of friends who are way riskier than I'm comfortable with. And so I don't see them in person. And, we've had some conversations about it and it's not helpful. And so we limit it to things that are not in person, and we stay away from that topic with each other. So, I think everybody's going through that. Recognizing you can support someone else, but you can't make everything better for them. So yeah, I see this a lot with families. So-and-so's going through a really hard time. I'm really worried about it. Okay, well, what can you do to help? Is there anything you can do to help? Is there anything they're willing to take from you? Maybe just being available to listen, or in a COVID context, pick up groceries, maybe. That's what you can do. And using distraction and self-care. We're going to talk about self-care strategies, but basically managing the worry by looking after yourself, calming yourself down, taking your mind off it. All right.
We had one person asking about anxiety with everyday life things, such as this, have I turned off the stove?
Okay. So with the have I turned off the stove example, that actually can be sometimes something called obsessive compulsive disorder, which is actually something I don't work with. I know what it is, and I can sort of explain it, but it's not one of my specialties, just so you know. But it is, so if you're worried about something like turning off the stove or did I lock the door, that's in the kind of normal range if you do it for, a couple of minutes every once in a while, or, you kind of think, oh, did I lock the front door? And then you just go check. And then when you check and you see that it's locked, you're fine, it's gone. You can go to bed or whatever you're going to do. If you find that it's something that you keep going back to over and over again, you keep checking over again, you think about it a lot, you worry about it a lot, you do things like leave the house and then come back, and then leave the house and then come back, and leave the house and then come back, in a way that interferes with your life, that really gets to be in the realm of a disorder, and probably would be something in the area of obsessive compulsive disorder. So if anybody's experiencing that in a way that interferes with their life, that is definitely something that you can get treatment for. Treatment works pretty well, and I really encourage you to do that. Okay. If it's a minor thing that then you have a hard time getting your mind away from it, again, distraction is a really good one, and I've got a list of distractions coming up. Okay. In terms of self-care, I've got this up here because in my experience, a lot of people seem to think that self-care and looking after yourself is weak, not okay, selfish, or self-indulgent, and it's not. It's really essential. And I really encourage people to take the time to do it. And it doesn't have to be hours and hours a day. I mean, even, 5 minutes here and there of doing some relaxation, or, reading a book, or watching a movie, or talking to a loved one, or, playing your favorite video game, whatever it is, doesn't have to be for a long time to make it helpful. And it's what allows us to help other people. So, and with COVID, our wells are being dried a lot of the time. So, this is a time when we really need to try and look after ourselves even more than we normally do. And again, that's not weakness, that's healthy, that's reasonable. And the more we look after ourselves, the more we model that for other people, especially our children. Really helpful. So try not to think of it as weak or selfish if that's something that you tend to do. I do find that's really common. Okay, self-care.
We do have one other question regarding anxiety in children, which I don't know if we're going to
Okay.
get
I
to,
don't
but
work with kids, so I might not be able to answer, but I'll try.
yeah, but it doesn't have to be this second. Just wanted to make you aware of it.
Well, might as well. Let's just. So, what's the question?
How to deal with anxiety with a 4-year-old who's anxious and sad.
Okay, so that's definitely outside of my area. What I would recommend is, I think I would recommend talking to your doctor. Four is tough because, normally I would say, well, talk to the teacher, talk to the school counselor. They're too young to visit that. If your kid is in daycare, sometimes daycare providers can be really good about kind of giving like a sense of like, is this kind of normal for kids at this age? But if your kid isn't in daycare, you don't get that. Some doctors are good with anxiety in all ages, some aren't. You could look at getting a referral to a pediatrician. You could also look at getting your child in to be seen by a psychologist or a counselor. Sometimes there's some very short, simple things that can be helpful. I would also recommend calling 211. 211 is the BC Information and Referral Line. They have everything that is, through the government, through charities, low cost, free, through the health authorities. So if you call out there and say, I have a 4-year-old who's feeling really stressed and anxious, what are my options? They will be able to tell you. So I'm sorry, I can't help you in terms of specifics, but I can say here's some ideas for resources. Okay. So for stress, social support, extra difficult in COVID. I have some other ideas coming for that, but social support is really helpful for stress, especially people who don't just say, yeah, everything sucks. Some people really reinforce negative stuff. That can be not the right person sometimes. On the other hand, you don't want to talk to someone who's just like, everything's sunshine and roses, what's wrong with you? Also not great. You kind of need someone who's going to understand and support you without making things look really bleak. Exercise is enormous for depression, particularly, but definitely for anxiety as well. Exercise is the thing. It is, aside from medication, one of the best things you can do for anxiety and depression. And so, again, it doesn't have to be 2 hours a day in the gym, like 5 minutes here and there, 20-minute walk, yoga video on YouTube. There's lots of stuff now available that's free due to COVID. There's more exercise stuff than there used to be. Many gyms have gone online or virtual as well. But honestly, YouTube is amazing. Walking is one of the things we can do with friends as long as we stay 6 feet apart. So that's a great thing to do. I know it's raining, but please, put on the rain jacket and try and do it. And like I said, things in the house is also great. Taking breaks, you need to rest. You need to hang out in front of the TV if that's what you need to do. You need to take a bath. You need to do something like senseless or something that has no goal other than, I just enjoy this and it's fun for me. That is perfectly legitimate. Getting help. So, that can be professional help, counseling, going to a family doctor, something like that. But also it can be as simple as, there's this one task that's really getting on top of me. Hey, could you do this for me and I'll do this other thing for you? I don't know, the lawn needs mowing, and I'll bake you a cake. Um, this one's harder in COVID again because we can't be inside together. But feeling okay about asking for help. Many people don't. Many people feel that it's a failure or a weakness, but really we all need to help each other. And people often like helping, especially if it's reciprocal. You can trade it. So please do that. Relaxation and meditation. Again, that's particularly for anxiety. That's great, and it can be 5 minutes or less, and it's still helpful. For some people, spiritual practice is huge, and churches. I think it varies, like how many of them are doing online services. I know I have a client who's Muslim, and the mosque has not been doing a lot of online stuff, but really try and check into it. And most spiritual traditions have some kind of like things that you can do on your own for yourself, if that's important to you. Expressing your feelings, needs, and wants. So not saying I'm fine when you're not fine. Maintaining your own goals and priorities. You can set you can decide what's important to you. Again, that varies. You have small children. You're working a lot. That limits it, but try to at least some of the time be aware that this is what I want to do. This is what's important to me. This is the direction I want to go in. And time for things that you enjoy. Okay. These are some relaxation techniques. Again, YouTube is great for this. And there's an app as well that I really like. It's called Mindshift. And it is done by Anxiety BC. And so everything on it is really well researched and good. But these are different types of relaxation techniques. Different people like different ones. I would encourage you to try different ones. And like I said, YouTube is fantastic for this kind of thing. And with yoga and Tai Chi, also on YouTube. And in the before times, Tai Chi anyway used to be by donation. So, not necessarily a financial impediment there. All right, this shows you how to do a progressive muscle relaxation. This is a nice, easy one to start with. Relaxation, by the way, most people think it's you have to still your mind. That is a type of relaxation. It's a really advanced one. Don't start there. It's really hard. People get really discouraged. So this is an easy one. And basically what you do is you work through all the muscles in your body, you clench them, and then you release them as you do deep breathing. It's saying 15 to 20 minutes. Yeah, it'll take that long if you work through your whole body, but you can just work through parts of it. If you know that your shoulders tend to be really tense, you can do those while you do deep breathing. It feels nice. Even the first time you try it, you work through your whole body, it feels like you've had a massage. So this is a nice, easy place to start. Most people like this one, not everybody, but it's definitely worth trying. And like I said, YouTube, look up progressive muscle relaxation. You'll find lots of resources. And it's on the Mindshift app as well. So this is just what I was saying in terms of stigma. It's not a sign of weakness. Everybody needs it. It's not just emotional stuff. You shouldn't be hiding it. Obviously, you don't want to talk to people about it who are going to be mean or make fun of you, but it should be a normal part of human experience. Different for different people. Again, sometimes a lot of time in session is often spent with clients sort of figuring out what are the best self-care techniques for them, for their life, for their priorities, what works best. Try some stuff, see how it goes. And here we go. Self-care during COVID-19. Just one of the things, we are all so stressed. So I think that one of the things that some people are doing, I don't exclude myself from this, is that we're sometimes not spending as much effort connecting with friends because it's harder. And so people can get hurt because, a friend isn't getting back to them, or not know how to talk to somebody if you've been having a hard time. And so just try and assume that if someone's not doing the best, if they're not being themselves, if they're not um, as good as they normally are at something, they're stressed. You're stressed. I had an argument with a friend before Christmas. I never argue with my friends. And this one friend of mine who I've known for nearly 20 years, we both were super stressed and we had an argument. And then afterwards, we were both like, "Wow, I'm sorry, I'm so stressed." So yeah, those kinds of things will happen. Try to be kind. Try to reduce your expectations. To maintain social activities, they have to be outside for a lot of the time. And yeah, going for walks is great. Any kind of outside activity that you like. People are doing kind of virtual runs. That's the kind of thing these days, actually. You can, be on a headset and be running in one place, and your friend is running in another place, and you're having a chat at the same time, or walking, or whatever it is that you're doing. Zoom, yes, we get tired of it. It has limitations, but it can also be like if you can do things. One of the things my family has done is we'll all have a pancake breakfast, except one of us is in Toronto and one of us is in Vancouver and another one of us is in Seattle. But we're all having breakfast at the same time and we're eating the same thing, and so it's a virtual meal. Same thing with watching a TV show or a movie together. There's lots of online games. We were playing Pictionary online. There's Scrabble. There's like tons of things. For some people, playing video games. And also, if there's any hobby that you do, I have one hobby where we have meetings every month, and it used to be in person. Now we do it on Zoom, and it just feels so nice to be connecting with people around something that has nothing to do with COVID and nothing to do with work, and learn something. Which goes to my next one. If you can, for some people, learning new skills is helpful. Again, some people have way more time now than they ever did. Some people really have less time. But if you do have time, there's something you're interested in, if it's not too expensive, some hobbies are much more expensive than others, although thrift stores are great for hobby materials. Give it a shot, but be nice to yourself if it's too hard. If you just can't focus to learn something new, that's okay. But for some people, it's definitely worth a try. Reducing alcohol and drug use, including caffeine, including nicotine. Caffeine, if you have any anxiety, can really send it right up. People who have anxiety disorders often, like, they can't really do caffeine at all. Sometimes people are simply doing too much caffeine, and that's what's causing their anxiety problems. But yeah, and helping others within limits. Caregiving is super stressful, but helping others is a way to feel effective, to feel productive, to feel like you're doing something, to address things, to take a sense of control. And so, yeah, if that's something that you have any interest in, whether it's COVID related or not, I would really encourage you to do that. And there's way more ways to do it than there used to be, because we're doing more Zoom and things like that. So, yeah. Okay. Seems like a good spot to pause again for questions. And I know we have like 20 minutes left. So I'm just going to talk a bit about anxiety disorders and panic. But any questions?
Oh, well, I think we'll just give people a minute to potentially type anything in chat here.
All right. Okay. Well, I will stop if a question comes in.
Okay, I will let you know.
All right. So these are the anxiety disorders: panic disorder, generalized anxiety disorder. That's the worrying that I talked about. Specific phobia. So, that would be things like fear of spiders or fear of heights, that kind of thing. Social anxiety disorder, difficulty in social situations. That one is very individualized. It can express itself in a whole bunch of different ways. Agoraphobia, that's fear of being outside. Um, Separation anxiety disorder, mostly children. Selective mutism, that's actually children not talking. That's it because it's a childhood disorder. It's not something I know a lot about. And these are the disorders that where anxiety is a significant component. So obsessive compulsive disorder came up earlier. Strictly speaking, it's not an anxiety disorder, but it has a lot of anxiety with it. Post-traumatic disorder, hoarding disorder. So that used to be a subtype of obsessive compulsive disorder. It's now its own thing. And illness anxiety disorder, which is exactly what it sounds like. It's a lot of anxiety around physical illness.
Rachel,
Yeah.
Wendy is wondering if you could let us know the difference between panic and anxiety disorder.
Yeah, I'm actually going to talk quite a bit about panic, but generally, so anxiety disorders are a group of disorders. So these are all the anxiety disorders that we currently have diagnostically. Panic disorder is one of the anxiety disorders, and essentially it's somebody who has panic attacks, and those panic attacks significantly affect their ability to function day to day. So, for example, somebody who has panic attacks to the point where they're frightened of leaving the house, because it can be associated with agoraphobia, that would be a disorder. But just having panic attacks in and of itself is not actually a disorder. And I'm going to talk. I'm really conscious of time, so we're going to have to skip a few things here. Okay, panic disorder. You know, 4% of people have it in lifetime. You can see that social phobia is one of the most common, 8 to 13%. So these are fairly common things. Diagnosis should only be done by a medical doctor or a registered psychologist. So if you see a counselor and they say they're doing diagnosis, no, they should not be doing that. But it's based on your symptoms. We don't currently have blood tests or anything like that for diagnosis. Predisposition, genetics, role modeling, sensitivity to physical sensations. Some people really notice if their heart is pounding, their hands are shaking, if they're feeling like, physical symptoms of stress, and they really notice and they really sort of worry about them. And so that and plus avoidance of situations that are perceived as dangerous, all of those contribute to the likelihood that you might develop anxiety, as well as being a member of a group that experiences discrimination or oppression. Stress is one of the things that can definitely trigger anxiety disorders. So this is the major reason why COVID and everything associated with COVID has really sent anxiety very high. Doubled anxiety in the pandemic, as well as depression. But basically any stress could be a buildup, could be a specific event like losing somebody that you love, can start you having anxiety problems or an anxiety disorder. That's just a nice little pretty graphic. So this is the diagnostic criteria for panic. So the first thing is that you have panic attacks. And a panic attack is what it sounds like. You're like, oh! It's frightening. And I actually get them sometimes. I do not have panic disorder, but one of my symptoms of stress is having panic attacks every once in a while. So yeah, they do not feel good. And it feels very, very intense. And if you don't know what's happening, especially if you don't know what's happening, it's really frightening. But then the next criteria is that not only do you have panic attacks, but that you worry about them, and that it has changed your behavior so that there's something that you're avoiding doing because you're worried you're going to have a panic attack. And then the others are basically saying, well, it's about panic and not about something else. Interestingly, severe anemia can have panic as a symptom because the body is really struggling to get enough oxygen in the bloodstream. That's not common, but it's an example of something that could cause panic-like symptoms. And it's a fight or flight reaction that occurs at the wrong time. We have fight or flight. It's an instinct, where our body has this thing which just says to us, danger, danger, danger. There is a bear about 2 feet away from you. You need to run or you need to fight. And if there really is a bear standing 2 feet away from you, that is exactly what you should be doing. What panic is having that reaction at a time when actually you're not in physical danger. There's no bear. It's okay. But your body is behaving as if you're in mortal danger. And if you're not, you have these physical reactions, and it's like, this is really frightening, and I don't know why it's happening because, there isn't a good reason for it as far as you can see. It's kind of a cycle of anxiety. So shortness of breath, muscle tension, you focus on the physical symptoms, they get worse, you get more frightened, and that can escalate into a panic attack. Yeah, so as you're having these physical sensations, some people notice that they get short of breath, their heart starts pounding, they feel faint. And of course, if you don't know what's going on, you focus on them and going, oh my goodness, what the heck's going on? Am I having a heart attack? Am I going to pass out? I need to pay attention to these things. I need to see if they're getting worse. And the more you focus on them, the worse they get. If you've ever tried to sort of focus on, your heartbeat, you'll notice it starts getting louder, faster. That's what happens when it's happening in a panic attack and you think, oh my God, this means I'm going to have a heart attack. Then, you'll tend to get into a panic attack. These are some of the physical sensations of
We have a couple questions that have hit on the same thing,
panic.
generally speaking. So we have two people who are worried about the COVID vaccine and anxiety around trying it, and anxiety around what's gone into it and whether they can trust it. And they're feeling a lot of what they're saying is worry or anxiety about all of that. I'm wondering your thoughts on it.
So in general, that's something that you can find information about it, right? So that's a good example of something that is an anxiety that could have a reality basis to it, but you can find out fairly easily if it does or it doesn't. So, my understanding, and you have to remember, I'm not a medical doctor, so I'm going by what everybody else goes by. But I would encourage you to talk to your family doctor, talk to a pharmacist, talk to somebody who has advanced training in medications and vaccines, and say, what do you think? Do you think the safety information is good? Do you think it's been tested enough? Do I have any, some people, I think that the advice on whether pregnant women should be vaccinated is a bit mixed. I'm not sure what the conclusion is in Canada on that. I think there may be some other situations where it's recommended that, people either get the vaccine quicker or they don't have to get it as quickly. But in general, get good information from trusted sources that are not relatives or friends who don't have a medical background. That's not the internet, because there's lots of information on the internet that's terrible. It's really hard to figure out. If you're not an expert in something, it can be very hard to figure out what's the right information. And then, so in terms of managing the worry, you can say to yourself, I'm going to find out the facts, I'm going to think about what works for me, and I'm going to make the decision based on that. And in the meantime, I'm going to focus on things that I can control. And whatever it is that the worry is, is it that I'm worried that I'll get it and it's not going to work? I'm worried that I'll get it and I'm going to get sick. Check out that information and do whatever else is reasonable for you to manage your COVID risk. And if you notice yourself worrying about it a lot, do a lot of distraction. Say to yourself, stop. I don't need to think about this right now. I don't need to make a decision. Or I have made a decision. I don't need to keep thinking about it. Stop it. I'm going to do something so that to take my attention away from it. And if the worry keeps going anyway, maybe, you're kind of edging into an anxiety disorder with worry and you need to get some treatment for that. So hopefully that helps. To go back to panic, and definitely, worry can get to a point where, it could trigger a panic attack. Anytime you have an anxiety issue, sometimes anxiety can get high enough that it can edge into the sort of 10 out of 10 anxiety of a panic attack. These are some thoughts that people have about panic, which tends to, of course, be very frightening while it's happening and increases the panic because your brain and your body interpret those thoughts as the bear is getting closer. Oh my God, you need to do something. Why are you not running or fighting? What the heck is going on? But it won't cause any of those things. There is a slight chance that with panic, there is a particular heart issue that can cause panic. If you go to the hospital with panic, they will check your heart. If that hasn't happened and you have panic, get your doctor to check it. It's rare. I mean, it's common enough it needs to be checked, but mostly if you have panic, it's not because you have a heart problem. And it's common to have a panic attack every once in a while. Grief is common, high stress. It just happens sometimes. It's not necessarily anything to worry about. This is the treatment. Some of my other slides are goes into details about how cognitive behavioral therapy works. But the general, for the takeaway message, cognitive behavioral therapy plus prescribed medication is the most effective treatment for most of the anxiety disorders. One of the nice things is that sometimes if you do the therapy, you don't need the medication. Sometimes if you do the medication, you don't need to do therapy. But in general, I suggest talking to your doctor about medication if your anxiety is severe or if it's not responding to the cognitive behavioral therapy techniques. Okay, this is details about how to manage cognitive behavioral therapy, how to manage anxiety. But essentially, you challenge your beliefs and assumptions, and you soothe your body, you calm your body down. Okay. So if we go back to the vaccination thing, maybe your belief is, this vaccination wasn't tested enough, it can't be safe. Okay, you can check that. You can talk to your doctor, you can talk to a pharmacist, you can see, is that true? I'm worried about this. Is it actually a problem? Okay. Sort of struggling here with what to focus on because I know we've kind of run over time and all right. This is a way to kind of analyze your anxiety. People often tend to get caught up in it and really feel like if I'm feeling this intensely, it must be true or it must be a valid problem. Not necessarily. It could be that, really this is something that sometimes it's something called free-floating anxiety. Your anxiety can attach to something kind of almost randomly, and then your anxiety about this thing, which really isn't a big deal, can seem a huge deal. So if you can take a step back from it and think, is this really a problem? Is it really a big deal? This can be where it can be helpful to talk to friends, talk to a therapist about it. What's the worst thing that can actually happen? Sometimes people are like, it will be a disaster if my spouse gets angry with me. Okay, and what's the worst thing that happens when your spouse gets angry? Well, they get upset and disappointed in me. Okay, is that really so terrible? How can you cope with that? How can you sort of work your way through sort of having that not be so bad, something that's, a problem that can be worked on as opposed to a catastrophe? I really like the question of what would you say this to a friend? So people often say things to themselves or about themselves that they would never say to a friend or a loved one. So people will say, I'm so stupid, or, I'm a loser, or everybody else can cope with this except me, or, all those kinds of thoughts. And you think, okay, would you say to a friend that you're a loser? You wouldn't, very unlikely someone would say that. So if you wouldn't say that to a friend, you shouldn't be saying that to yourself. It really indicates that you're being really hard on yourself. You're probably not seeing the whole picture. You're probably, you're probably really escalating your anxiety with some of the ways that you think. And this is very Cole's notes. It's not as easy as this, but this is just kind of some of the process that you go through when you're doing cognitive behavioral therapy. These are some of the beliefs about panic. They're not true. They feel true. For example, people start to close when they're having a panic attack. They feel like they're choking. It's not actually closing, it's tightening. You're not going to choke if you're having a panic attack. And these are some ways to challenge the beliefs. These are fact-based, right? The panic will end. The physical symptoms are because of fight or flight. I'm not actually in danger. Take some deep breaths. The physiological process of a panic attack is fueled by hyperventilation, so panting. You start to take some deep breaths, gradually your body will stop panting, and that helps to interrupt the physiological symptoms. I've got through this before and I will again. those kinds of things. And different people have different challenges or thoughts that work for them. So there's like lists that you can look at to find a couple of things that you find believable that will work for you. So these are some of the ways to deal with panic. Recognize the start of it. You interrupt it at the start before it starts getting really intense, much easier. Slow down your breathing, do some relaxation. Cold or ice calms down the nervous system. I love that one, especially for people who have driving anxiety. You can do that and drive, and it's safe. If possible, do something physical like running or jumping jacks. Intense physical activity for about 20 minutes. If you can do that, really good at reducing the arousal in the nervous system, reducing the body anxiety and distraction, taking your attention away from physical symptoms. So here's some ideas of distraction. These are also good for COVID. You know, I actually made up this list more than a year ago, and I look at it now, and almost all of them, or all of them, you can do even in social isolation. That was a fluke, but there you go. So these are some good ways to distract yourself, take your mind off your worries, especially a non-productive worry. Some other ideas in here in the graphic: photography, puzzles, jewelry, dancing, you know, spending time with your kids, painting, whatever it is, baking. This is an intense distraction. Counting backward from 280 by 7. It's supposed to be hard because you literally can't think of anything else while you're doing it. And then when you get to the end, you sing "We Are the Champions." And that makes you laugh. And laughing really is great to reduce anxiety. You can't laugh and be anxious at the same time. So if you can, I really recommend that one. And you really can't think of anything else while you're trying to count backward from 280 by 7. So give it a shot. And then the exercise as hard as you can for 20 minutes, cold water or ice. Progressive muscle relaxation. That is a relaxation technique that's particularly good with intense emotions, including panic. Okay, I'm not going to talk about exposure. We just kind of don't have time. Okay, so to sum up, anxiety is a common experience, very common. It can be a serious problem, but there are simple ways to help yourself cope with it. And hopefully I've given you enough ideas that can apply to COVID as well. If you think you might have an anxiety disorder, talk to your doctor and consider seeing a therapist who specializes in cognitive behavioral therapy. And if possible, try to get help earlier rather than later. Many people wait years to get help. It's really common. I can't remember what the statistics are, but I think it's something like 5 years of having panic before people get help for it. You know, similar kind of numbers for worry and all kinds of things. So the earlier the better. You know, it's easier to treat earlier, but you know, if you've had something for 10 years, come in anyway. We can very likely make it better and really improve things. So we might, you know, and quite possibly treat it entirely. One of the things I love about panic is that as a therapist, it's such a hard thing for people to have to cope with. And from a therapy point of view, often it's really easy to treat. So I love doing panic work for that reason. It makes such a big difference quickly for a lot of people. And here's some resources. And while you're looking at that, I'm sorry we only have like 2 minutes, but I can stay later if anybody else can. Yeah, anybody have any questions?
Thank you so much for that wonderful talk, Rachel. I'm going to post a survey in chat along with some referral services that the BC Psychologists Association has. Also our YouTube channel where you'll be able to see this again once it's uploaded. And of course, any questions people have, please go ahead and post. Quite thorough, thank you.
All right, if nobody has any questions, like I said, I can hang out for another couple minutes if that's okay, or
I think one person was wondering who the worry workbook was by, and also I'm assuming that's need a referral for CBT?
No, not necessarily. So, in terms of seeing a psychologist or a counselor, you only need a referral if your health insurance requires it. So, for some people's extended health, in order for it to be covered, they need to get a doctor's note. But for many people, it's not true. You don't have to. So if you have extended health coverage, just check and see what you need. But a lot of the time, you don't need a referral. And we don't need a referral. We're not part of the medical system. We're separate from that. So there's no need for a referral. If you want to see a psychiatrist, which is a medical doctor who um, does treatment for mental illness, mostly medication these days, that does require mostly requires a referral from your doctor. If you're in Fraser Health, potentially in Vancouver Coastal as well. But in Fraser Health, there's a service called ASTAT, ASTAT, and it stands for Acute Short-Term Assessment and Treatment. And you do not need a doctor's referral for that. It's a clinic, several clinics, and you call them or you walk in and you can get psychiatric services without a referral. And also other services as well. So, but I mean, 211, literally you just call 211 and they know about all the services that are free, cheap, whatever. And they also know whatever the process is for referral. So, different agencies, some you can just walk right in or call them. Others, there's some kind of referral process. Some of the children's services, you need to be referred by the Ministry of Children and Families, things like that. 211 will be able to tell you all of that stuff. I don't like their website, I have to say. I think it's really not very good. I recommend for them. But for the Worry Control Workbook, it's an older book. I don't know. So that's the Worry Control Workbook. And it's by somebody called Mary Ellen Copeland. I think it's out of print, unfortunately. The newest version, but you can still get it. If you can get it, I would recommend it. The newest version of the Anxiety and Phobia Workbook, which is this one, it's 7th edition. It has a chapter on worry management in it. So it's better than nothing, but definitely the Worry Control Workbook is what I would recommend. And the Mindshift app as well also has got the relaxation stuff in there. It's got cognitive therapy techniques, all sorts of different anxiety disorders. So I'm 99% sure it has worry. Worry is one of the things that can be dealt with through Mindshift.
And we have one person wondering what ASTNT stands for.
ASTNT? Is that the ASTAT thing that I just mentioned?
Yes, probably.
Okay, so ASTAT stands for Acute Short-Term Assessment and Treatment. And it's through Fraser Health. And I know about it because I'm in Fraser Health, but Vancouver Coastal quite likely has something similar. And again, you can find out by calling 211.
And just to answer that question about where the recording will go, it will go on our YouTube channel, and also again posted a small survey link that you can let us know what you thought about this talk and any other talks that you may attend in the future, but specifically
So
this
when
one.
you say the user channel, is that through the
chat?
Okay.
Yeah.
Okay.
And so all of the links, I've posted links to everything I just chatted about just above there, Julia.
Oh.
Oh, are there any other questions?
Well, thank you all. If unless someone's typing a question right this second, thank you all for coming. I really hope that next year we'll be able to do this in person. It's so nice to be able to sort of just have people call out questions, but this is the best we can do, and I think it's way better than nothing. I have to admit, I do really like not having to leave the house to go do this kind of stuff in terms of attending talks as well. But there's something great about being with other people too. So maybe next year. Thank you very much.
Thank you so much, Rachel.
Okay.
Thank you, everybody, for being here.